Robotic surgery has revolutionized the treatment for many cancer surgeries. To know about the robotic surgeries, there are three parts to it. One is the surgeon console, or called the master. This is the patient side cart or the arms, that is the vision cart. One arm is used for the camera. The other three arms we use various instruments. This is the latest, that is a 4th generation robot that we have here. Biggest advantage is due to the sleeker arms, and there is wrist movement in the 360 degrees. Hi, this is Dr. Satish Pawar, Chief Surgical Oncologist, Kaizen Oncology Network, Hyderabad. Today, let us talk about robotic surgeries. So, robotic surgery has revolutionized the treatment for many cancer surgeries. So, especially in those areas where the arms or in open surgery, or the instruments in laparoscopic surgeries wouldn't reach, the robotic arms are able to reach. Hence, the need for robotic surgeries in this era. To know about the robotic surgeries, there are three parts to it. One is the surgeon console, or called the master, and this is the patient side cart or the arms. This is called the slave, and that is the vision cart. So, from one single dome, we have 4 arms that come out from the dome, and then these arms are joined and are very flexible, can move, and then we'll be able to put one arm as the camera port, and on the patient we make smaller holes, put ports, and then attach these arms to the subsequent ports onto the patient. And one arm is used for the camera. The other 3 arms we use various instruments from which we can do the surgery. The surgeon sits on the console, that is the master, and controls remotely all the arms. So, the biggest advantage of this is that the surgeon, with the help of the latest network of internet, we can operate remotely on a patient. Sitting here, I can operate almost 800 to 1200 kilometers away on a patient in the other hospital there, in other countries as well. That's why this is the remote access. Apart from that, the Da Vinci robot which we have now is the first robot that has been used on the humans, and this robot is the latest, that is a 4th generation robot that we have here, and the arms have become sleeker and hence occupies lesser space in the operating area, and the maneuverability or the movement becomes easier. So, this is 8 millimeter arms over here, and we make 8 millimeter holes into the abdomen of the patient, or into the chest of the patient, or in the neck of the patient, and operate on various sites, right from the oral cavity to the neck, to the chest, to the abdomen, and to the inguinal region as well. Why robot is superior from the open surgery or laparoscopic surgery is the vision. Vision is the three-dimensional vision, and apart from that, the vision which is there is 10 times more. So, 10x is the vision, and hence the picture quality is good. The biggest advantage is due to the sleeker arms and the maneuverability. What happens is there is wrist movement in the 360 degrees. So, because of this, it can reach to the narrow spaces, and the dissection becomes easier, the suturing becomes easier, and because of the vision, blood loss is lesser, the nerves are preserved more and more in many surgeries. Hence, the functional outcome is more superior than the classical open or laparoscopic surgeries. Thank you.